Very attractive to new families. Increased savings. This is perfect portability. You don't have to argue about the portability of a policy. You own it. You are the guy. More doctors move into primary care. You don't have to set up laws and stuff like Hillary Clinton wanted to do. We're going to mandate that medical schools produce X number of family practitioners, and so many people are trained to do abortions, and all of this stuff that she imagined was going to happen back in the Clinton years. You don't have to mandate more private family practice doctors because they're going to want to go into this. Many people stay out of family practice because family practice is many, many visits, billing lots and lots of individual events at a very, very small margin. And 31 cents out of every dollar in healthcare is spent on the billing cycle. The average office employs 2 people full-time to generate bills that get paid at 9% or 40%, and 31 cents out of every dollar spent is spent on that whole process. If somebody walks into my family practice office and I give them some service and they stroke me a check and the thing is paid, then I'm going to want to have that business. I'm going to want to have that practice because it's a wonderful life. Family practice is a wonderful life. You have families, you have people that you follow throughout their entire life. Anyway, so you don't have to mandate policy. So Alabama will grow in the number of people we most need to take care of people, to keep them going to work and doing all the things we want to do. And it makes the physician-patient relationship a direct one. You don't have third-party people that are stepping in between the doctor and the patient. It's a direct thing. You need to have your gallbladder out. Oh, really, doc? What's that going to cost me? Yeah, well, we'll make the arrangement. Can't pay? Pay me later. Whatever. It creates a more just society because it keeps people one-to-one in the doctor's office. Reduced cost for industry, we talked about that already. And it reduces the cost of production on the unit cost. It makes Alabama industries more competitive because this is how those offshore organizations work. You think that they're blowing money and wringing their hands over healthcare policies? No. You want to work? Here's what we pay. You don't want to work? Get lost. Right? Of course, we don't work that way, but certainly if you go to Singapore, that's what you'll find. Anyway, it makes Alabama industries more competitive if they don't have to constantly wrestle with the cost of healthcare and health insurance. Better bottom line for hospitals, we talked about that. You don't put hospitals in this billing cycle where they're waiting for the insurance company to pay off. The longer the insurance company hangs on to the money, the less time the hospital has the money. In an inflationary economy, they're losing money every minute that ticks away. So the hospital has a better bottom line if you structure things this way. Saves the health insurance industry. I'm not saying do away with health insurance because the health insurance industry, if you don't do something to solve this problem, health insurance industry is the next victim. They're going to be driven out of business. They will create the one-payer system as a matter of policy by doing the things we talked about. So if you want to save the health insurance industry, this is what you want. They're just going to structure their business differently. They're going to emphasize these term policy type arrangements. They're going to be the ones selling the high deductible, high premium policies. They're going to be investing in the subscriber is the investor rather than other outside investors, right? So it makes the insurance industry more just. So they aim their policies at the person who's paying the premium rather than at the other investor. Right now, health insurance industry, collect premium, deny care, report that to your board of directors and your shareholders. Kind of perverse, isn't it? Okay. Why is it attractive to the state of Alabama? We talked about that. It is the future. But what about the poor? We didn't talk about the poor. Remember, in the history of healthcare in America, the poor have always been cared for. We didn't need the federal government to come instruct us about how to take care of the poor. The single best example is the Mayo Clinic. This is a worldwide recognized, one of the finest medical systems in the world, and it was founded by a band of little nuns, the Sisters of St. Francis, whose every waking thought is, how will I care for the poor? How will I care for Jesus in the distressing disguise of the poor? This is the thought that animates their every waking moment, right? And they created, through their efforts of charity, the finest medical system in America today. And every city has hospitals like that. The Methodist Hospital, the Baptist in Memphis, every town has hospitals named for their charitable works, right? You don't need the federal government to instruct us on the care of the poor. in fact, there's a thought that animates this. You render unto Caesar the things which be Caesar's, and unto God the things which be God. Care of the poor is one of those things of God things, remember? It's one of the very first things that happened when we came up out of the catacombs. It's always been that way. This is a Roman coin with the image of Julian the Apostate on it, as a matter of fact. This would be Julian's coin, and you can just send it back to him and go, keep your medical system, son. This is not yours. Okay? Last thing, tell me if I'm run out of time here. Last thing is Medicaid. This is obviously a big issue in the state of Alabama. It bankrupts the system very early on. And the only way to manage the Medicaid issue is to manage demand. If you can't manage demand, then you're basically this shell game of moving money from one process to another within the state. All of it is a loser. It's a loser for the state. It's a loser for the providers. Medicaid patients, on average, I pay to take care of. I pay to take care of. By the time I go through all the hassle of a bill and prior authorization, everything else that my staff has to go through to get payment for a Medicaid patient, I do better if I never mention it to anybody. Right? If you give tax relief to people who take care of Medicaid, they never send you a bill. All they do is they track the fact that they took care of a Medicaid patient. You manage it just like any other deductible issue. You drive down demand, and it encourages every practitioner and every hospital to take care of a significant number of Medicaid patients. It does. Because now I'm going to get tax relief if I take care of Medicaid patients. This is state law that can be addressed to make that happen, in the same way that land grants were used to establish hospitals in the first place. You're using the treasury of the state to manage the problem without actually levying taxes or writing checks or creating a huge bureaucracy to manage where the money's going. All you got to do is report that the Medicaid patient was cared for. Problem solved. Okay. That also encourages stable relationships within the community. Medicaid patients are no longer the orphan person who shows up in the ER. That's my Medicaid patient. He comes to my office. I take care of that patient. I know him. Right? Justice. Okay, we didn't get here overnight. We're not going to solve this overnight. They got us incrementally. We're going to get them back incrementally. We're going to do it a step at a time. Tort law is mostly state law. And Alabama, of all the states in the Union, does pretty well in that regard. We do better than probably 45 of the other states in terms of tort. But insurance law is also mostly state law. And so we have to, on the one hand, prevent the federal government from doing away with health savings accounts. House Bill 3200, as it's sort of being proposed, there aren't any actual bills, but it's all this talk. HR 3200 has within it the disestablishment of health savings accounts. If they do that, that's a disaster, right? So we have to fight against that. But on the state level, this transparency of the bill and encouragement of the health savings account approach, encouraging industry to manage their new employees that way, right? They don't have to just wash their hands of their insurance program. All they got to do is you got to encourage new employees to go that route. And it'd be very attractive if you actually show them these facts. Me, as a young startup father of a family, I'm going to go, yeah, I'm going to be working at Boeing for the next 20 years. I'll come out the other side of that with $250,000 in my HSA. This is good. This is good. We direct our legislative effort to the solution at the most local level possible. Okay, that's what you want to do. You want to keep it as local as you possibly can. And every time you ask a question, ask yourself that question. So, success in Alabama will be imitated by other states. If you show an economic model that works to promote industry, to promote savings, to promote local investment using the healthcare issue, other states will want to imitate this. And we have to particularly keep track of the freshman class of 2010. 2010 promises to be another 1950 kind of year. There's a lot of people who are going to be looking for work that used to be in the legislature, right? But remember 1950. Lots and lots of incumbents were kicked out. But here we are today, 59 years later, and we're still talking about this issue, and we're still losing on the issue. So the freshman class of 2010 has to be talking to each other, state to state. Here's what we're doing in Texas. This is what we're doing in Alabama. This is what's happening in New Hampshire. We're going to keep these HSAs up. We're going to lower the ceiling.